When should I start planning for long-term care? This is something that's become more of an issue for people, especially with us living longer than we ever have before, and it's important and critical to get this decision right for your retirement success. Here to discuss this important topic is Bruce Elfenbein. He is a certified financial fiduciary with the Retirement Company. So Bruce, long-term care. Such an important subject. So many folks need to plan for this. When should someone start?
The earlier, the better. Mm-hmm. And you have to understand, it's not necessarily about buying something. Mm-hmm. It's all about having a plan. Okay. We have homeowners insurance. Mm-hmm. Chances are our house isn't going to burn down.
Right.
We have auto insurance. Mm-hmm. Chances are we're not going to get in an accident, but we have it. Mm-hmm. But for long-term care insurance, if you're married, there's a 50% chance one of you is going to require
some sort of
long-term care.
Right.
Now, again, it's not necessarily about buying something. Mm-hmm. It's all about having a plan. Mm-hmm. For example, one of my clients, she said, look, I'm from Sri Lanka. Mm-hmm. We take care of our family in Sri Lanka. We respect the elders. If I needed anything, I'm on the first plane back to Sri Lanka. My family has a big house. We're near a beautiful beach. And I told her, that sounded like a good plan. If I need, I'm going to be on the next plane after you. Tell your family to get another room together. But it depends on your needs. If you say, well, listen, my daughter would take care of me, that's fine. Mm-hmm. That's a plan.
Right.
The most common thing I get from clients is, look, I don't want to be a burden to the kids. Mm-hmm. I don't want to have to move in, interrupt their lives. Mm-hmm. I don't want to put them through that, you know. If that's the case, then you better have the funds to be able to take care of long-term care. Long-term care today, if you go into a facility, you're going to be spending anywhere from, on the low end, $65,000 to $80,000 to over $100,000 a year. Mm-hmm. There's nothing, and I wrote an article about this for the Wall Street Journal a number of years ago. Mm-hmm. There is nothing that will deplete a nest egg quicker than a chronic illness, that need for long-term care.
Right.
And yeah, long-term care, if you get it young enough, is pretty inexpensive. Mm-hmm. As you get older, a couple of things happen. Not only do the premiums go up, your ability to qualify for it goes up. Generally, when people come to me to have a discussion about the long-term care, it's right after either they had to take care of someone or they had a friend or a relative that had to take care of someone, and they saw how devastating that was to their finances and to their personal life. Unfortunately, by the time they come to me, and they might be in their 70s, and they're like, oh, I think I might need this now. When they find out how expensive it could be at that time, and they probably might not even qualify for it medically, not a good combination. A number of years ago, we did a study, and we found that people say, well, I could self-insure. If anything happens to me, I have plenty of money. The magic number there is at least $2 million. At least it was about 10 years ago, so it's gone up since then. If you have at least $2 million there, yeah, you can probably self-insure. If not, get a plan. Again, it's not about buying something. It's all about having a good plan.
Now, you mentioned, just because we started off the show, the segment with when is the time to start planning. At what age should someone ideally be planning for this?
I've had folks that have started as early in their 30s. I've had other in 40s, 50s, 60s. Generally, when you get past the 60s, it gets very, very difficult, not only to qualify, but the premiums can be very high.
Yeah. So what I'm hearing you say is it's never too early to get started.
Never too early, because there are times, especially if you're in your 30s or 40s, the premiums are like really cheap. You're like, really? This is good. And here's something a lot of people don't think about. Only about half the people in long-term care facilities are there because of age or illness, over 65. Half of the people there are under 65, and they may be there because of an accident or an illness,
or whatnot. Yeah.
And guess what? Your insurance, whether it's health insurance or whether you're Medicare, doesn't matter. It has limits. There's only so much that it's gonna cover you, and then after that, you're on your own.
Absolutely.
Right? Yep. So even starting young enough, even in your 30s and 40s, Suppose you have an accident while you're skiing, or you slip and fall in a banana peel or something like that, and you break a leg in 3 places. You're going to be in a facility for a couple of months.
Right.
You better be able to take care of that.
Well, and with the costs the way they are, this is something you definitely need a plan in place for. So if you have questions about your own long-term care needs and you would like someone to help walk you through and navigate this important conversation in your own life, we encourage you to reach out to Bruce and the team of the Retirement Company. To learn more about Bruce Elfenbein and the Retirement Company and how they can help and serve you, we invite you to call this number, 786-546-9302.